Hi, my name is Danielle Baxter, and the career that I chose this time is an individual and family therapist. And an example organization that I found is actually located in Maryland, but it actually sounded like a great opportunity. And for this one I found it really interesting, and I really like that there's a lot of different working environments that are available. There's large and small organizations. You can work in a private office. You could also be an off-site provider where you go to give counseling to children and families in their homes and in their schools. Another option is providing counseling in a psychiatric partial hospitalization program for children and adolescents. And in that one you would be working with a team of doctors and nurses on the kind of counseling that they need. So you'd be working specifically with the doctors, which is also really nice. For this position, normal daytime work hours are 8 to 5. For some jobs, just depending on where you work, sometimes they require evening hours as well. And depending on what organization you work for or what company and what type of office you're working in, you may be able to have a schedule that is family friendly, and the positions can be full or part-time, so it kind of just depends on who you're working for, whether or not that could work out for you. The typical stressors for this job is that you're working with people who have a myriad of different issues, who may or may not want to be attending counseling. So some of these issues are depression and other affective disorders, childhood behavioral and emotional disorders, marital and relationship problems, conduct disorder and delinquency. And then there's some substance abuse, alcoholism, domestic violence, severe mental illness, and physical illness. So some of these clients may specifically be there because they are court mandated, and some because of the pressure of a family member, but they may not have a desire to change or to work on certain things in order to get better. So that would be a difficult situation to be in for the counselor, but it is also kind of taxing to be in that kind of situation. I believe that you would have to be able to kind of separate yourself from what those people are experiencing, so not take on their problems and their challenges as your own, that you're able to put those in their place as something that you do at work. The typical benefits are paid time off, covered holidays, health, dental, and vision insurance, group life insurance, and a company matched IRA, so those are pretty good benefits. The common job tasks include the diagnosis and treatment of mental and emotional disorders, individual child and individual adult psychotherapy, couple, family, and group therapy, treatment planning, marriage and relationship counseling, premarital education and marital enrichment, life coaching, and then you would do the typical record keeping and paperwork for each client. The educational requirements are either a master's or doctoral degree in marriage and family therapy, and 2 years of supervised clinical experience that is required. The starting salary range is $55,000 and it goes up to $90,000. Some miscellaneous career information that I really liked is that Spanish-speaking therapists are highly desired, and they're often offered bonuses, sign-on bonuses for being Spanish-speaking. That's one thing that I liked because I do speak Spanish. So those are just some of the things that I learned about becoming an individual and a family therapist.